Think paracetamol is harmless because it's over the counter? Here's what most people never hear about this everyday drug. 1. Liver damage. The liver processes paracetamol, but in high doses, it produces a toxic byproduct called NAPQI, which can cause liver failure. Taking more than 4,000 millinamolars a day or mixing it with alcohol is especially risky. 2. Digestive problems. Regular use can irritate the stomach lining and, in rare cases, lead to nausea or abdominal pain, especially if taken on an empty stomach. 3. Mood and sleep effects. Some studies suggest that frequent use may blunt emotional responses, dulling both pain and pleasure centers in the brain. 4. Kidney strain. When combined with other painkillers or dehydration, paracetamol can increase stress on the kidneys over time. 5. Hidden overdose risk. Paracetamol is in hundreds of cold and flu products, which means people sometimes double dose without realizing it. Always check your labels. 6. Safe use. Tip: if you need it for more than a few days, consult your doctor. Avoid alcohol, stay hydrated, and track your dosage. Your liver will thank you. It's cheap, effective, and easy to find, but only when used wisely. For more science-backed health truths, hit subscribe.